Good morning. Okay, first just get a test for the sound. Testing, testing, testing. And let me also check now. See how is the sound. Check now. See how is the sound. Check now. Okay, sound is good. Good morning. Today is August 5th, a Saturday. This is our regular yoga therapy class and session. And as you know, it used to be in person before, and now it is virtual online. We are presenting first the requests we get, and also we are presenting our experience based on the sessions we have been conducting for years and years and years. So the last session, which was also a request, was yoga therapy for asthma, and today we'll be talking about yoga therapy for COPD. COPD stands for chronic obstructive pulmonary diseases and pulmonary fibrosis, like thickening of the lung. And one of the reasons for presenting this is the pulmonary fibrosis. We don't understand the pathophysiology or how this disease occurs, and many a time we describe this called idiopathic pulmonary fibrosis. Idiopathic basically means that I don't know what causing it. Could be autoimmune, it could be some underlying irritant, toxin, whatever. The experience I had, I won't say recently, a few years back, is that two of my physician friends, I won't say friends, but I know them like one of my colleagues, they went for an overseas trip. They had symptoms what sounds like a flu, maybe what we call a H1N1 or all the flu strain. I don't know all the names of the flu strain now. And they came back, they started having shortness of breath, and in a short time they developed fulminant pulmonary fibrosis. And you know, when you have a serious pulmonary fibrosis, your life expectancy is not too many years. So let's talk about what we start first is a pathophysiology, because that is a very important. And as I always mention, all of you who are watching this, you are experienced yoga practitioner, you are experienced yoga therapist, you are a healthcare provider. So you need to know what is the underlying mechanism and how we can pick and choose the practices, the yoga therapy practices, same as asanas, pranayama, meditation, or what is a philosophy of yoga, Yoga Sutra of Patanjali, and the 8 link practices. First, let's talk about lungs a little bit. Lung has a 6-liter capacity. So you need about 1.5 liter of air to keep the balloon. Lung is like a balloon, to balloon open. So you have a 4.5 liter of air which you can exchange, which is called vital capacity. The amount of air we breathe in and out in a regular breathing is only 500 cc. That's called a tidal volume. That is almost 4.5 and 9, almost 1/9 of the tidal volume. So the lung has about 80 to 90% reserve. And then think about it. Out of 500 cc, what we are inhaling from our nose to the upper part of the trachea and bronchus, that air is not exchanged. That is called a dead space. So out of 500 cc, about 150 cc is a dead space. So basically have 350 cc of air for exchange with a one normal breathing. We have the inspiratory capacity. That means able to breathe in the amount of air is almost 3 liters. It's no joke, you know. It's almost 6 times that what is our normal amount of breathing. Expiratory reserve, that means amount of air you can breathe out, almost 1 liter. Why the disparity? Disparity is that inhalation is active. Inhalation is done through your muscle tone, but exhalation is passive. It's a recoil of your lung, and there are some muscles of expiration, but primarily the muscles are muscles of inspiration. So when a child is born, you don't have to teach the child how to breathe in. The child will breathe in before you even know. It is the breathe out you have to teach. So when inhalation is active and exhalation is passive, inhalation is sympathetic. It raises your heart rate, raises your blood pressure, raises your even respiratory rate. Inhalation is sympathetic. Exhalation is parasympathetic. Exhalation is relaxing. Parasympathetic we call calm and digest. So learn how to extend your exhalation longer than inhalation without any effort, which you call an effortless ease. No yoga therapy should be done with the effort. All the yoga asanas, every practice should be done with a effortless breathing. If you have any effort in breathing, it shows that you are not practicing yoga practices. As simple as is. Then when you have a respiratory difficulty, you develop which is called the pranomaya kosha to manomaya kosha. Your mind gets affected and you start becoming anxious, restless. So mind needs to be quiet down. So the underlying condition, what is causing it, is in COPD, in chronic obstructive pulmonary diseases, it is primarily a chronic bronchitis. Bronchitis means inflammation of the bronchioles, the small. Asthma, on the other hand, what we talked about yesterday was a tightness and spasm of the bronchioles. Here we are talking about inflammation. And all the inflammations are primarily coming from external sources, as you know. Even all the viruses we get, flu viruses, RSV viruses, COVID-19 viruses, and all the pollutants and all the dirty air we have been inhaling. So the chronic bronchitis also with the inflammation causes little bit narrowing of that space. That is called chronic obstructive pulmonary disease, obstruction. That means you cannot breathe out. So if you look at the bronchioles, like it's the branches of a tree, and at the end of the bronchiole, you have a sac called alveoli. And the other side of the sac there is a small blood vessel called the capillaries. So the alveoli, the sac, is full of your fresh oxygen which you are inhaling from your air. And on the other side, the blood vessels have all the carbon dioxide and all the end product of metabolism, which we call a desaturated hemoglobin. The hemoglobin carries all the contents. Desaturated means it is getting dirty, and oxygen is really the end product of metabolism. Whatever you are eating, the end product is your glucose. Glucose combines with oxygen, forms carbon dioxide, water, and ATP. ATP stands for adenosine triphosphate, which is an energy. So when you get an obstruction in the bronchioles, the alveoli, the sac which is at the end, they're also separated by septum. The septum breaks down and it ends up with a big, like a bleb, balloon, whatever we call it, a blebs. And that condition is called emphysema. Emphysema is now the septum is breaking down, the alveoli is connecting, it becomes a bigger and bigger and bigger balloon or bleb. Now, this balloon is not properly eliminated. So the exchange which takes place, the carbon dioxide comes to your lung and the oxygen goes from the lung to the blood, and the blood, which was called desaturated, is now become saturated with a hemoglobin. Now in COPD, since the carbon dioxide is not eliminated, it also enters into the blood, giving a high level of carbon dioxide in the blood, causing your call narcosis, CO2 narcosis, carbon dioxide in the high level in the blood causes an effect of a narcotics. So it's amazing what the CO2 does. That CO2 also then affects your called chemoreceptors. Chemoreceptor sensitivity goes up, so it doesn't affect anymore. So in a yoga practice, what is called a baroreceptor sensitivity goes down and chemoreceptor sensitivity goes higher. So you have to learn how to breathe out and remove this carbon dioxide in a COPD practice, which will come back shortly. In a pulmonary fibrosis, fibrosis means is a scar tissue. Like when you have a cut, if your hand gets cut, you will see it gets healed up, but it forms a scar. A scar tissue happens because called fibroblast, a fibrotic tissue which holds together. When the lung is inflamed, that the sac, which is called alveoli, which is the lining of the lung, which gets inflamed, then the inflammation is resolved with fibrosis. So now the layer of the lung, which is alveoli one side and the capillary with the blood on the other side, this thing is getting thickened and thickened and thickened. So the diffusion means exchange of oxygen to the blood and carbon dioxide from the blood to the alveoli is slowly and slowly started getting down. They're not happening much anymore. What is interesting, as all of you know, as I said, that you have 4.5 liter vital capacity which you can exchange on your own, and you have a 0.5 liter which you are breathing in and out, which is called involuntary breathing. Breathing is both voluntary and involuntary. So you have about 80 to 90% reserve in the lung. By the time you develop shortness of breath, it's already too late. Another important thing is that not able to breathe creates a fear, anxiety, and mental agitation. If you ask me, what is the biggest fear in your life? Biggest fear. There were a lot of jokes about biggest fear, but forget about the jokes. Biggest fear in my life is not able to breathe. See what happens when you're able to breathe. What happens to your mind when you're not able to breathe. We have a lot of medications which are called bronchodilators. So coming back in pulmonary fibrosis is a progressive disease. There is no treatment for it. There is some newer medication which prevents the deposition of the fibroblast by blocking that inflammatory pathways. The medications are also very strong, have a lot of side effects. So, pulmonary fibrosis is almost a fatal condition. Now, what will be our practices? The experience we have is worth sharing with you. People with COPD and pulmonary fibrosis came to our class on a wheelchair with a portable oxygen with a continuous nasal oxygenation. So where do you start the practice? You say, okay, come on, sit down on the mat and let's do some asana and pranayama practice. Remember, pranayama means pranayama. Pranayam. Prana is the life force. It's a unseen energy which keeps us awake and alive. Pranayama, control and restrain. Pranayama means voluntary regulated breathing. Like voluntarily I can regulate breathing. It is not a breathing exercise. Remember, not a breathing exercise, because we don't want it to exercise in a yoga therapy. See, exercise is sympathetic. Complete yoga therapy practice is parasympathetic. Exercise help is after the parasympathetic activation. Body starts parasympathetic tone to counteract that sympathetic activation. As simple as it is. So, your practice will start with the people sitting in a chair. I sit down in this chair all the time. That is your kneeling stool. But you sit down in a chair. This is a nice chair, three-legged chair for me. I had it for years and years for my yoga practices. And let's start. How do we start? Sitting in a chair. So I'm sitting in a chair. I have oxygen cylinder behind me. I have two cannula, oxygen cannula, because of my COPD or pulmonary fibrosis. And now, first is keep your spine straight. Sit down with the spine straight and start quieting down your mind. How do you quieting down your mind? Effortlessly increase your exhalation time. Hand mudras connects your body and mind. So touch your index finger and thumb. This is your Gyana mudra and Dhana mudra with a spine straight. touching your index finger and thumb, putting over your knees. Close your eyes. We have 5 senses. We hear, see, smell, taste, and touch. All the 5 senses keeps us awake and alert. Once you close your eyes, the mind quiets down. Bring your attention to your breath. Even if you have a nasal cannula and are breathing oxygen, slowly breathe out completely effortlessly as long as you can. Doesn't matter how long. There is nothing called a deep breath. There is nothing called a, exercising for breath. It is basically increasing the timing for inhalation, increasing the timing for exhalation completely effortlessly, and that will reduce the number of breath per minute. And with the practice, you develop a neuroplasticity, and your breathing rate will come down, and you will be able to breathe same way when you're even sleeping. Because breath has both voluntary and involuntary function. Involuntary function is controlled by your brain stem, and voluntary function is controlled by your cerebral cortex. So breathe out first. Slowly take a deep breath in. And breathe out longer than breathing in. Your eyes are closed. You are not competing with anybody. You are all doing the practices on your own. You will see slowly and slowly. You keep doing it. If you're doing it with me, you'll see slowly and slowly the amount of time will get longer and longer without any effort. Today you can do maybe 4 seconds out, 2 seconds in. 4 seconds out will be 1 and a 2 and a 3 and a 4 and a 2 second in, 1 and a 2. Normally we breathe between 15 to 16 breaths per minute. If you can do 2 seconds in and 4 seconds out, it's already 6 second cycle. Respiratory rate came down to 10. And when you develop a relaxation response, parasympathetic activation, you develop a saliva in your mouth. Like my mouth is completely wet now when I'm talking to you. I didn't drink any water, I've been talking to you. So I'm already in a parasympathetic mode. And what is effortless breathing? That you are able to talk and able to sing. So this is your beginning practice. What we find out in our experience is that people with COPD and pulmonary fibrosis, they have a hard time doing the exhalation because the air is getting trapped in that small balloon. We call it a blebs. So very simple, gentle Kapalbhati pranayama is the beginning of our practice before you're doing any asana practice. We do all the asanas sitting in a chair. So first practice is exhalation longer than inhalation. Kapalbhati pranayama is, you have a balloon here in the abdomen, you have a diaphragm here, you have a balloon here. You push your belly button inside, it hits the diaphragm, air comes out. It is called active exhalation. You don't make any effort to breathe. Remember, inhalation is active, and inhalation, you can keep on increasing the timing of both inhalation and exhalation because the muscles of respiration are skeletal muscles and they can be trained. Like you're training your biceps for a weight training. You can do 5 pounds, then you can do 7 pounds, in a short time you can do 10 pounds, you can do 15 pounds. All question about timing called neuroplasticity, same way as a muscle of your brain. For us who have been practicing so long, we can easily do 20 seconds out, 10 seconds in. As simple as it is. Let me show it to you. I will do 16 seconds out and 8 seconds in. Initially what we do, we breathe out first. I'll be breathing in with a count of 8. Very nice. 8 seconds in, 16 seconds out. I'm still talking and breathing function. Kapalbhati pranayama is done with the hand mudras. You know, daily practice when you do, we do, this is your dhanu mudra, jnana mudra, quite on the mind. With the index finger down, it's called a vayu mudra. It controls your vata. Touch your middle finger. This is your Shunya mudra, controls your hearing. Ring finger is called your Prithvi mudra, controls your kapha. And touching your little finger is Varun mudra, controls your water, controls your bladder function. Little finger and ring finger is your Shakti mudra, it's your strength. This is your middle finger and ring finger and thumb is Apna mudra, is a proper mudra of digestion, elimination. Put an index finger down, it is called Hridaya mudra. It is the proper function of the heart and lung. Then you can touch the other fingers, it is your Vayana mudra, and then you can do your Linga mudra. In daily practice, we do about 50 Kapalbhati pranayama each, but for COPD, we tell them sit down and very gently push your belly button in the back. And newcomer to the practice, tell them, put your hand in your belly button, put your other hand here. The moment you push your belly in, air comes out. A lot of patients came and told me, I cannot do it. You cannot do it? It's okay. Then learn how to do it. Can you cough? Can you cough for me? Why don't you cough? Try to cough with your mouth closed. Mouth is closed. Try to cough. Becomes Kapalbhati pranayama. So I'm just going to demonstrate with only Dhanu mudra or Jnana mudra and see what is going to happen to me in a person with COPD and pulmonary fibrosis. Spine is straight, eyes is closed. I'm pushing my belly button to the back. Active exhalation, but no inhalation. Okay, I did about 20 of them. Did you notice I didn't do any inhalation? My practice was totally exhalation. So what happened? In between the two exhalation, I did inhalation without knowing. Cannot stop breathing. There is enough we call it a receptors, sensors, which is going to make you breathe. Our experience is people even come to our class on a wheelchair with oxygen cannula, with a short Kapalbhati pranayama. They're able to remove their oxygen cannula and being comfortable. So tell them, continue. This is not like a Western pharmaceutical pill that you took one. Yes, you will have a changes with your practices, no question about it, physiological changes. But you have to continue, you have to do it daily to have its effect. Next you learn all the relaxations, like you do the hand relaxation with your Balu Mushti Mudra. You put your thumb inside and close, like a baby fist. You do it a breathing. Breathe out first, you inhale, exhalation, you close. Eyes closed, inhale and exhale. It relaxes your hand. When your hands are relaxed, your whole body gets relaxed. When the hands get relaxed, hand, almost half of your brain controls your hand. So when hand is relaxed, you'll be seeing all the fingers are separated, hand is all, you can do relaxation. Wrist gets relaxed with the extension, and this is a tightening. Breathe in, breathe out. Relax the shoulder. Just rotate your shoulder with your breathing. Breathe in, breathe out. You're doing the backwards. Breathe in. I'm showing you the technique, but when you do it, you continue a little longer, as long as your body will allow. So you'll be doing the primary pranayama practice, but that is what your voluntary regulated breathing. But when you do the asana practice, it is a relaxation response. You let you have your pranayama practice a little better. Put your hand on the shoulder, elbows together, breathe out first, take a deep breath in, and slowly breathe out. So we are using the same practices what we do for our daily practice, but we pick and choose what you need for this ailment, COPD and pulmonary fibrosis. Breathe in, breathe out. And do the opposite. Breathe in, breathe out. Also, if you cannot bring your elbows together, please don't force. Stay where you are. Stay where you are. If you're here, is okay. But do the opposite side. Very, very important concept. No pain, effortless breathing, effortless ease. dis-ease, D-I-S space E-A-S-E. When your ease becomes dis, you get a dis-ease. And the treatment is effortless ease. You know, all the concept of push yourself to the max is great. Push yourself to the max causes a little mild hypoxia. And little hypoxia helps to build our strength, stamina and strength. It is very good, building muscles. But for healing, everything has to be done in an effortless ease. You can hold your wrist on the top, breathe out first, take a deep breath in, keep your eyes closed, pull it down behind your head. Same breathing cycle, put it high up. Breathe in, breathe out. Then, see, this is the part of our daily practice, what is called a Shukho. Then what we do, quiet down our mind, and quiet down our mind is one is your chanting. We teach them how to do a continuous Om chanting. So that is done sitting here, closing eyes, and you say, let them continue as long as they have no effort in breathing. Then incorporate Bhramari Pranayama, bumblebee breathing. Bumblebee breathing is that our brain has a frequency, or in fact our every body organ has a frequency. We create a frequency from outside, like a sound of a bumblebee. Two frequencies interacts, cancels each other, called a harmonic resonance. It's pure physics, and then the vibration goes away. Close your eyes, put an index finger in the forehead. You can do Shanmukhi Mudra, or also you can put your fingers to close your eyes and the ear, close your mouth. You breathe out first, and then you will breathe in and breathe out with the sound of a bumblebee. Wonderful practice. Follows with the pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Make the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. The ciliary muscles get relaxed. Eye is supplied with the 4 cranial nerves, SO4, LR6. Muscle superior oblique is supplied by 4th cranial nerve. Lateral rectus muscle is supplied by the 6th cranial nerve. Retina is connected to your optic nerve, and outside is supplied by a trigeminal nerve. Massage your forehead, massage your eyes, massage your face. All the muscles here attached to the skin, So the muscles are relaxed, all the lines goes away, all the frowning goes away, all the lines in the face goes away. Bring your hand, massage behind the ear, in front of the ear, inside the external auditory canal. There is a branch of vagus nerve called auricular branch of vagus nerve. It causes vagal activation, which is a parasympathetic tone. Take the hand and massage the side of your trachea. It is massaging your carotid sinuses. When you massage your carotid sinuses, you relax and quiet down your cardiovascular system and nervous system. We do a carotid sinus massage with a supraventricular tachycardia when your heart rate starts going high up. Then bring your hand to the back and massage to the back like a occipital tubercle where the two muscles are attached, sternomastoid muscle and trapezius muscle, is supplied with a cranial nerve. Now you incorporate this for people with COPD and pulmonary fibrosis with a Paschim Namaskar, prayer pose to the back, and a Brahma Mudra, movement of the neck with the sound of your bumblebee. So let me come a little close to you and you will be able to see it better. You have seen it many times. I sit in a chair, do the same thing, but I'm in a kneeling stool. So put your hands to the back and slowly you will see. You may not even come to that area first. See, I'm able to see from here. Okay, so you will see I'm putting my hand but don't try, even if it is here, keep it here. Slowly when it comes up, keep your spine straight and put the hands in a prayer pose, and the prayer pose and slowly go high up. And remember, staying in a pose with an effortless ease. That is what practice of yoga therapy is. Able to stay. I've been doing it for so long, I'll be able to stay here for minutes and hours, maybe in the days. Next, I will be doing, on the same posture I'm holding, I'll be doing the Brahma Mudra, the 4 positions of the neck with my Brahmri Pranayam, with the sound of a bumblebee in exhalation. That's why we extend our exhalation. Eyes are closed. First one is breathing out first. Slowly take a deep breath in and drop your neck to the back. Be sure there is no pain and you have effortless breathing, and breathe out with the sound of a bumblebee. One more time. Breathe out first. Deep breath in and drop your head back. This is a profound relaxation response, and this is also called a chest opening pose. And we have seen in our research study the chest opening poses increases your pulmonary function and also cardiac function. As you know, lung and heart is the same organ in yoga. Next step is a side bend from the neck. Breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. I'm showing you the technique, but when you do practice, do it a few more times. So how many times? Up to you. Effortless ease and no pain. Finally, turn your neck from the left to the back to the right in the front, then from the front to the right to the back to the left, with the same sound of bumblebee in exhalation. You also notice to the sound of this bumblebee, your exhalation also became longer and longer. It's a wonderful practice. So as you know, the chest opening poses, this is called prayer pose to the back, the Paschim Namaskar, you have a chest opening poses like a fish pose, called your Matsasana, you have Cobra, Bhujangasana, is a chest opening poses, are very good to improve your cardiopulmonary function. So as your side stretch and spinal twist. So what you do, you can do both, like you can sit again, you sit in a chair with a handle, which we're doing it. So you can slowly take your one hand to the back, another hand on the, breathe out first, take a deep breath in, and slowly twist your body as far as you can without any effort in your breathing. Then you stay here between 5 to 10 breaths. If you are doing in an effortless ease with your eyes closed and you're not competing with anybody, you will have no problem doing 5 to 10 breaths with an exhalation longer than inhalation. It's a wonderful practice for people with COPD and pulmonary fibrosis. Same thing, do the other side. Breathe out first, as long as possible without any effort. Long breath in. Side stretch, forward bend, all are achieved with your sun salutation. Surya Namaskar, sun salutation, sitting in a chair. Or you can do a slowly, we call it a triangle pose in the chair. You can hand goes down, other hand will slowly go high up, but don't push yourself. It is going to come on your own, and wherever it can come, you stay here. Able to stay in the pose for at least 5 to 10 breaths is going to yield your therapeutic response. Non-competitive, listening to your body's signal and progress, say, in stages impossible become possible. Say always to the other side, yes, this side I can come this far. Stay this far. If you stay here a little often, it will go a little bit more. Slowly go a little bit more. You will go a little bit more. So it will happen. Why? It happened to all of us. It will happen to you too. So let me show you a sun salutation or Surya Namaskar in a chair, and then you can do, before that you can do other few things for your chest. Very interesting. If you do a Gururasana, like an eagle pose in a chair, it's a wonderful practice. It's a wonderful practice. Eagle pose in a chair. So take your right foot, put it over your knee, slowly twist around like an eagle and twist over, and sitting in a chair. Excellent for your knee problem, hip problem, back problem. Then my right knee on the top, right hand, take my both the hands separate, turn around, I'm in an eagle pose. And I stay here, close my eyes, breathing out longer than breathing in. You talk about COPD, talk about pulmonary fibrosis. Said, okay, therapy is coming. Then also remember, it is your daily practice. I do not buy myself, I, we, they, him, her, everybody. 2 days a week, 3 days a week, few days a week. It's almost impossible. This is your lifestyle, your lifestyle. daily practice. If you make an attempt for a daily practice, you might end up in 5 days a week, maybe 6 days a week, because something is going to come and interfere with your practice. So done with this side. Balance, opposite side. You're all wrapped around. Now what? Left knee in the top. So left arm is in the top, left arm is in the top. Eagle pose, Gurdasana. You talk about pulmonary function, you talk about cardiac function, you talk about ejection fraction. In ejection fraction, the venous return is better with this practice. So, preload gets increases preload, and with relaxation, peripheral resistance comes down, reduces afterload. It improves your ejection fraction. No medication can do it. What this is doing. Same way, like when you put your head down, you get a increased baroreceptor sensitivity. It acts like a beta blocker, an ACE inhibitor. That's what you explain. How do you can slowly get out of your beta blockers, ACE inhibitor, even statin and aspirin, both. Pranamasana. Eyes closed. First asana of your Surya Namaskar, sun salutation. Hasta Uttanasana, with your breathing. So here, you start with the breathe out. Breathe in, Hasta Uttanasana, hand raising. Breathe out, Padahasta Asana. Touch your hand on the ground. Maybe I can be able to see a little bit better. Okay. Padahasta Asana. Hand goes all the way down to the ground and your head goes between your knees. Asya Sanchalanasana, your feet goes high up and the body goes back. Parvat Asana, take your and look your head towards your belly button, Parvatasana. Ashtanga Namaskar, put your head down, put your head all the way down, Ashtanga Namaskar. Bhujangasana, you open your chest and look all the way high up. Asya Sanchalanasana asana in the other side, opposite knee. Padahasta Asana. Hasta Uttanasana, hand raising, Pranamasana. Started with breathing out, ended with breathing in. 12 steps. Very gentle, wonderful practices sitting in a chair. Also you can do relaxed like we said, sitting in a chair, put your finger, separate your toes. Toe separation helps relaxing your feet. You take your knees, bring it up, slowly bring it down. So all this relaxation, what we do, very effective to prepare your body and mind for the practices. In a pranayama practice, as I said, which you think very effective. So for the COPD, first you have to strengthen your lung. Lung gets strengthened with your Bhastrika pranayama, which is called a bellows. Bellows you can do, raising hand high up, pulling it down. But you can do sitting very simply. If you cannot do it, sitting and gently doing a active inhalation and active exhalation. In a pulmonary fibrosis, we teach them to the breath holding. And very gently, slowly breath holding, both in inhalation and exhalation. Oh, I get so much of comments. Oh, breath holding, it is so dangerous. We don't recommend. We are a long-term yoga teacher. It's great. Don't do it. But you are doing a breath holding as if it is your normal breath. Could be 5 seconds. It's okay. Slowly it will become 8 seconds. Slowly it will become 10 seconds. Slowly it will become 20 seconds, 30 seconds, 40 seconds. You don't know. There's a power of neuroplasticity. So when a COPD people comes, I said, why don't you do a gentle Bhastrika pranayama with your shoulder movement. Very simple, at about 100, but my body is warm. It created a hyperventilation syndrome. We do it in daily practice. I do 500, 600 more, but that's a different issue. I've been doing it for a long time. Do what you do. A gentle Bhastrika pranayama. Bhastrika improves your pulmonary function. It is like a gateway to pranayama, preparing your lung to be strong and more functional. Again, as I said, Kapalbhati pranayama with all the mudras. We'll do 50 each. Let me show you. Maybe I'll do a 10 in each mudra for the time's sake. So you'll be able to assess it better. So how to do it. Sit down. Dhanu mudra. 10 Kapalbhati pranayama. Vayu Mudra, and I'll tell you what it is doing. Keep on doing it. It massages the internal organ, massages your liver, massages your stomach, massages your spleen, massages your colon, massages your intestine, massages your pelvic organs, massages your kidney. For the women, it massages your uterus, tubes, ovaries. For the men and women, massages bladder. For the men, it massages your prostate. Shandamudra massages your diaphragm. Above the diaphragm, you have a lung. It massages your lungs. So the air comes out. In between the lung is the heart. It massages your heart. From the inside massage. When you massage the heart, it's called a CPR, cardiopulmonary resuscitation, Prithvi Mudra. We call this is a internal CPR, internal cardiopulmonary resuscitation. We do every morning the Jalneti. We put the water, let's say, in water in the nose and clean the nose. So it is very obvious that when you're practicing, a little bit of air which stays into the mucosa, it comes out, called irritation in the nose, it could have a sneezing, coughing, but it's entirely normal for your practice. Varun Mudra. Shakti Mudra, it helps your strength. It also ignites your Agni, Jathar Agni, the fire in your stomach. Then it increases the Teja, Prana, Teja and Ojas. Teja, the light inside your body and mind. So it looks like you are glowing. Kapal Bhati means, Kapal means a forehead, Bhati is a shining. Your forehead is shining. Hriday Mudra, index finger down. Vayana Mudra, Udana Mudra. When you do, it looks like it's been glowing. Linga Mudra. So, we do it generally, as I now practice, about 50 on each mudras. I just should do 10 in each mudras. And you notice that how slow Kapalbhati Pranayama. When you keep on doing it, slowly and slowly, you'll be able to see, you'll do 1 per minute, a very rapid, strong Kapalbhati Pranayama, like this. Kapalbhati Pranayama in a slow speed is Pranayama. When you do in a rapid speed, it becomes a Kriya. Kapalbhati is one of the 6 Kriyas, Shat Kriyas. Do very rapidly. You do like this. This is also called Agni Pradhan Pranayama. It ignites your Agni. Bastrika Pranayama called your Prano Pradhan Pranayama. It brings prana in your body. As I mentioned to you, the chanting quiets down your mind, the Bhramri Pranayama quiets down your mind, and also your Ujjayi Pranayama with your chin lock and your left nostril breathing. The whole exhalation is done through your recoiling of the lung. So you learn how to hold your breath so that slowly and slowly the lung expands. It cannot go beyond the thoracic cage, so it recoils back. When it recoils back, it's called a Herring-Brewer reflex, and it's a vagal activation. So you can do, first is called your Savitri Pranayama, say 4 second in, 8 second hold, 8-second out, then 8-second hold. Inhalation called puraka. Breath holding in inhalation called retention, called abhantarin kumbhak. Exhalation called rechaka. And breath holding in exhalation called suspension, called bhajya kumbhak. And so one example of Savitri Pranayama. Breathe out first. Breathe in with a count of 4 in. Hold for count of 8. Breathe out with a count of 8. Hold your breath with a count of 8. One set of Savitri Pranayama. You do breath holding in inhalation and incorporate your chin lock, Jalandhar Bandha. It is called a Murcha Pranayama. Murcha means unconscious. It is so calming, so cooling. It literally takes out all the inhibition from your body and mind. It lets you breathe better without any anxiety, without any activation of your mind, and you are able to even remove the oxygen cannula which you are carrying. Breathe out first. Slow, long inhalation. Hold your breath. Drop your chin down towards your chest. Hold your breath and keep counting, like 1 and a 2 and a 3. Wonderful practice for pulmonary fibrosis. It helps in diffusion. Breath holding in exhalation. And also, when you are doing this pranayama practice, you are already in a meditative state. You do alternate nostril breathing. Alternate nostril breathing is quiet down your mind. Then you do alternate nostril breathing without closing your nostril. That is a meditative alternate nostril breathing. In an alternate nostril breathing, what you do, close your one nostril, breathe out through the other nostril, left nostril. Breathe in through the left nostril. Close your left nostril, breathe out through other nostril. And continue this alternate nostril breathing. So then you put your index finger and middle finger in your third eye and bring your concentration to the third eye. Take your left hand, cross your hand and hold the right ear low. This is your super brain yoga. Now we do the alternate nostril breathing. Exhalation longer than inhalation. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is called your Chandranadi, moon energy, cooling energy. Right nostril breathing, right nostril is controlled by left brain. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic. Right nostril breathing is called your Suranadi, sun energy. Activates both sides of your brain. Literally quiets down all the brain functions. Wonderful experience. Then you learn practicing how to do alternate nostril breathing without closing your nostril. Why? Because when you close your eyes, you can clearly visualize your body, which is called a subtle body, gross body, sthula sharir, subtle body, shukha sharir, and karana sharir, or causal body. When your eyes are closed, you can able to do everything. You touch your head, touch your left index finger, touch your left ear lobe, touch your right knee. Same way you can bring concentration to your ear, on your nose. I can do alternate nostril breathing. Spine is straight, eyes are closed, hands are on a Dhyana Mudra. My focus, awareness, my mind is in the left nostril. I'm breathing out through the left nostril. And breathing in through the left nostril. Breathing out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. In your practice, you'll be doing it silently with the eyes closed. And again, when I'm doing this, I got a profound salivation in my mouth. It's a salivation which tells you you have a parasympathetic activation. Let's finish with the practice called Ujjayi Pranayam. Ujjayi Pranayam is slowly constricting your larynx. Try to breathe in, which is called your resistive inhalation. Larynx is supplied by the two nerves, superior and inferior laryngeal nerve, which are branches of your vagus nerve. So slowly it's a vagus stimulation. Vagus nerve, 80% is an afferent. That means it admits, its signal goes to your brainstem. And the signal coming out from the brainstem comes out through your hypoglossal nerve and glossopharyngeal nerve. Glossopharyngeal nerve supplies your soft palate, the muscles called palatopharyngeus and palatoglossus. It tightens them up, it slowly reduces your snoring. It's almost like you call a surgical procedure called UVPP. Hypoglossal nerve pushes the tongue in front, so it helps in sleep apnea. Ujjayi Pranayam is very effective in sleep apnea. And then the chin lock stimulates your carotid sinuses. Left nostril breathing is your parasympathetic. Another one to build up your lung is your resistive exhalation. It is called a Shankha Pranayam, blowing a conch shell. You'll see the conch shell blowing competition goes on in Florida. Huge big conch shell. The put I said these are pranayama practice. I don't have any conch shell. I use the hand for. It's like a to adhimudra. Put one in the top. You generally do all your voluntary regulated breathing. pranayama practice through your nose. You don't use your mouth. Use your mouth many a time just to do the little techniques. So here, I'm going to breathe out first, take a deep breath in through my nose and breathe out through my mouth as if I'm blowing a conch shell. Breathe out first. Take a deep breath in. Wonderful practice. Resistive exhalation. Resistive inhalation, resistive exhalation. Also, another very good for your lung and heart bone is your balancing poses. You're going to go behind the chair, you start standing on your non-dominant foot, then you do your tree pose. I have all of them after last few sessions, which is called your yoga therapy for better balance. Simply, and also keep the chair in front of you is very important. Keep the chair in front of you and then just get into the non-dominant and dominant. Let's finish with the last practice, with a very effective and most calming and cooling practice is your Ujjayi Pranayam with Ujjayi Pranayam with your Jalandhar Bandha, chin lock and a left nostril breath is your Chandravedi Pranayam. There cannot be any practice so relaxing, so improving the lung functions with quieting down your mind. Wonderful practice for your COPD and pulmonary fibrosis. So let's finish it here today. We have next Saturday. Yes, I'm here. And if you have a request, you can send a request what the session you want to. I'll be glad to honor your request. And also send some comments and questions. I'll be glad to answer for you. Okay. Thank you for joining. And we will keep in touch and come back on next Saturday.